The most important talk in this masterclass is going to be on frailty. I believe this talk, the frailty explanation, is the foundation of this entire masterclass. Well, let me tell you what is frailty. This scenario is rather common. Imagine Mary has had a hospital admission and she's not quite back to her baseline, and you are wondering why Mary is not walking the same way as she used to. So the doctors told you during the hospital admission that Mary is frail. So what is frail? Now, frailty is in fact a big concept which appeared in the 21st century. When I was a junior doctor 25 years ago, nobody taught us about frailty. So how did it come about? Well, the explanation will tell you why. Frailty is a state of vulnerability, and your understanding of frailty as a carer, as a non-healthcare professional, is different from what we medics understand by frailty when we write frailty as a diagnosis, for example, in discharge letter or clinic letter. Now, frailty is a state of vulnerability. If I ask you, carer, what is frailty, you probably will think of Mary's neighbor, Rose, who does appear frail. She's all bent over, maybe on a Zimmer frame, pottering around. Or you might think of Michael, who is in a nursing home, and Mary is visiting Michael regularly because they used to be neighbors, and he is completely bedbound. So in your mind as a carer, as a non-healthcare professional, frailty is someone who is visibly frail. And that's where the misunderstanding comes between the carers and healthcare professionals. Because frailty can be invisible, at least at the beginning. Right, let's understand. What is it, frailty? It's a state of vulnerability which comes upon amalgamation of three factors: age-related changes to the body. And I'd like to make sure straight away that age alone does not mean frailty. So it is age-related changes to the body, as well as disease-related changes to the body, as well as the side effects of the medications which the patient is taking as a result of all these multiple medical conditions. So the amalgamation of all these three factors makes Mary or David vulnerable. So in the face of an even minor healthcare problem, be that a little bit of a cold maybe, or even constipation, chest infection, minor urinary tract infection, they deteriorate so fast that the deterioration is shocking to you. You go to see the general practitioner and they just explain to you this is just a simple infection and they will get better, but you are quite surprised how confused Mary has become. So why this is happening? Because they are vulnerable. The physiological reserves have expired, so the body can no longer fight the infection as well as it used to do when Mary was 20-30 years younger. They are vulnerable. The deterioration from a simple medical problem is completely out of proportion to the medical problem which caused it. And that is what frailty is. Now, may I once again emphasize that frailty and age are not the same thing. I have a patient, Dorothy. I'm going to put up Dorothy's video now. Dorothy consented for me to share this video. She's 94 years old and she came to see me when she was in her late 80s. She thought that she's just getting old. She started falling about, but I diagnosed a medical problem, which of course I will talk to you about in the Falls Clinic. And we've treated the problem. She's completely fine now. And several years later, look at her. Look at her walking. She's 94, she's fast, she doesn't need any sticks or anything. And look at her swirling around as well. So she's quite a cheeky, our Dorothy. Frailty is amalgamation of all those problems. What do I mean though? When I say age-related changes to the body, what do I mean by that? Well, you can't go against the nature. As we grow older, we do develop degeneration, wear and tear of our various body parts. For example, most of us will develop a degree of what we call small vessel disease, and that is furring and hardening of the blood vessels of the brain. Most of us will have that to a degree over the age of 80. the kidney function goes down a little bit, the liver shrinks a little bit, the brain shrinks a little bit. So all of that is happening, but on its own, unless there are on its own, these problems don't cause major trouble. You just function normally. It is not until you get the amalgamation of medical problems such as diabetes, high blood pressure, constipation, memory troubles, falls, fractures, and then you start taking medications for all these conditions, blood pressure medications, which might drop your blood pressure, you feel dizzy, you fall, you fracture, your diabetic medication, metformin causing diarrhea, your painkillers, codeine causing constipation, then you can't eat, you start vomiting. So all of that together causes this frailty. And it can be invisible. Even with all of this, Mary might be functioning independently, doing quite well, and in fact, Mary might not come across as a frail at all to you, to the carer, until that urinary tract infection comes. And only then, when they go confused, weak, they stop eating, they end up in hospital, you suddenly realize that Mary is not going to get back to her normal, not in a week, not in a 2 week, because the body reserves have so much expired that she's struggling to get back to normal. Let me give you an example. I will illustrate this on a case of Mary and her, let's say, less frail member, Dorothy. Mary and Dorothy are of the same age. They look the same, they drive, they live independently. Imagine now a line. This line in your mind, the line, is the line of independence. If you are above that line, you are independent. Below that line, you lose your independence. Now, the further above that line you are, the less frail you are. And our Dorothy is sitting up there. But our Mary, she has diabetes, high blood pressure, she had a mini stroke, TIA last year, she's taken a few medications, she's just above that line. So both of them are above the line, and to you, to the carer, they appear the same because they are both independent, driving, doing their own things. But when that urinary tract infection comes, Dorothy, who is far above that line, she has no medical problems, she's not on any medications, so she gets a urinary tract infection. Her general practitioner gives her 3-5-day treatment of antibiotics, and although she is a bit under the weather for a few days, she recovers, and with maybe a little bit of a help of her family, but she does not need hospital admission. She is now back to her normal self within a week or so. However, our Mary, who is just above that dependency line, she gets that urinary tract infection. She is frail. The body reserves are not the same. So she develops confusion because she has a bit of a thawing and hardening of the blood vessels. And remember, Mary had a mini stroke, TIA, a year before. So her brain reserves are not the same as Dorothy's brain reserves. So with an infection, she develops confusion. As she develops confusion, she can't eat and drink anymore properly. And she starts falling, and she ends up in hospital. And of course, what happens to Mary or David in hospital? They get deconditioned. This is another term you will be hearing from the medics a lot, deconditioning. What that means is that they lose their previous level of mobility. Because in hospital, people spend most of the time either lying or sitting by their bed. They are not using their muscles, and when you are an older person, you don't use them, you lose them. So within a week of hospital admission, you find your mom or dad not being able to walk. So that's what deconditioning is, and it is our major job to prevent the deconditioning, and you can do that by trying to get them out of hospital. The sooner the better, or not allowing them to end up in hospital in the first place. Now, when Mary comes out of hospital, the things might never be back to their normal base, and that's what frailty does to people. So there is a lot of preparations you can do, how to prevent the frailty, and the whole idea of identifying frailty early for you as a carer, knowing that Mary or David are pre-frail or frail, is to put together a plan which will help them not to end up in hospital and get more confused and lose all their mobility and muscle power, and have a plan in place which might help to reverse a little bit of their frailty, maybe cut down on a few medications. So there is a tool out there which I highly recommend you to Google now. It is called Clinical Frailty Score. The other name is Rockwood Score. As you can see, it is very self-explanatory. If you stop the video now, I'll give you time to Google it, okay? And then you can continue. So can you see now on your mobile phone? It is very self-explanatory. The score is from 1 to 9. And think of your Mary or David and put your loved one now on that score. Whereabouts are they? Are they Rockwood 4, 5, 6? You see, when they are sitting, when they are pre-frail 1, 2, 3, that's the best time to actually get Mary or David to the geriatrician or general practitioner, review their medications, see whether they might be having any symptoms, and see whether we can reverse the frailty. So when they are hit by that UTI, they are a bit stronger, right? If they are already 4, 5, 6 on that score, we are in trouble. You need to urgently get Mary to be seen by someone to do that holistic, whole person assessment and see how we can optimize them. If David is now 6, 7 or 8 on that score, well, things gone too far, and here we need to do a proper care planning, hospital admission avoidance plan, even end-of-life care planning, and we will cover that in the other clinics. Other tools, there are many other tools. As a carer, you can look into frail tools. So if in the word frail, think of every word. Okay, I've got it outlined here. So F stands for fatigue. Has David been tired most of the day for the last 1 month? R stands for resistance. Has David been struggling climbing stairs recently? A stands for ambulation. Has David told you that they used to walk their block really easily, but now getting to that post office just 1 block away, they are struggling now and they can't do that? What about I? I stands for illnesses. Have they accumulated a few medical problems? And L stands for loss of weight. Has David lost more than 5% of their weight in the last 12 months? So if these things are present in Mary or David, they are getting frail. And don't wait until they get that UTI, get confused, fall and end up in hospital. Because guess what? Frailty is reversible. And when you are dealing with a frail person, we start thinking of changing the goals of care, because Mary up to now might have been having a very disease-orientated goals of care. She might have been going to endocrinologists, the diabetes doctor, who'd say, well, Mary, we need to bring your blood sugars further down. Mary might have been going to cardiologist who has been saying, oh, Mary, I don't like your blood pressure. We need to bring it down below 140 over 90 or 130, whatever. We have a blood pressure clinic, by the way. We will talk about that. Now, they might have been going to another specialist addressing other disease-related changes. But when one is frail, the disease-orientated goals of care, which were very much relevant up to now, and thanks to these disease-orientated goals of care and tight control of diabetes, blood pressure, Mary successfully did come into her 80s. But we now need to change them into a patient-orientated goals of care. And this might be completely different in a frail person. For example, Mary might tell you, you know what? I feel so dizzy with these 4 types of blood pressure medications. I'm taking 9 drugs. Is there anything we can do to cut down on number of these medications? So that's a a patient-orientated goal of care, to cut down on number of medications, to help her with dizziness because she has fear of falls, because she feels dizzy all the time. The other goal of care might be going to her yoga classes in the morning or just meeting friends, but she's on water medications and she's scared that she will wet herself while she's out with her friends. So that's a goal of care. What can we do? Can we give those water medications every other day maybe? So can you see how much can be done for a patient with frailty? One, to reverse the frailty. Yes, we can turn the clock back if we catch the frailty in a timely manner. We can postpone, slow down the progression of frailty. Or if the person is very frail now, we can change the disease-orientated goals of care into patient-orientated goals of care and improve quality of life. The main thing is for you to understand what is frailty and be prepared for that discussion with healthcare professional, and also be prepared when they recognize frailty in your loved ones and help them. Help them not to go downhill fast enough, so within being maybe on that scale, today they might be Rockwood 4, but if we don't do things correctly, within 12 months, Mary might be Rockwood 7 and 8 and end up in nursing home. And that's what we're here to prevent. Well, I hope this helped. And we will move to the next clinic. You can now go scroll down the list and in alphabetical order find the next clinic you want to pop in with me. I'll see you in the next clinic room. Bye!